a very rich person. Big Pharma official who has been rebuked for making the U.S. opioid emergency has licensed another medication to fix opioid compulsion, which means he is set to trade out further on the savage scourge he made, to the tune of a huge number of dollars. Richard Sackler, whose family claims Purdue Pharma, the organization behind the famous painkiller OxyContin, was conceded a patent not long ago for a reformulation of a medication used to wean addicts off OxyContin, the medication that made Sackler and Purdue Pharma billions, while starting a national well-being emergency. Sackler's recently licensed medication is a type of buprenorphine, a mellow sedative that controls tranquilized desires, regularly given as a substitute to heroin addicts or individuals snared. Sackler's own particular top-of-the-line sedate OxyContin. The new definition as depicted in Dr. Sackler's patent is required to end up profoundly lucrative and make the organization a huge number of dollars because of an unfaltering ascent in the gigantic number of addicts being dealt with for opiate habit. FT reports, last year, the main variant of buprenorphine, which is sold under the brand name Suboxone, created $877 million in U.S. deals for Indivior, the British pharmaceuticals assembled that makes it. Before the opioid emergency, the Sackler family was essentially known for its altruism, developing as one of the biggest benefactors to expressions establishments in the US and UK. Be that as it may, the rising number of addictions and passings has featured the family's responsibility for, which a few individuals have attempted to modest far from. Dr. Sackler's patent, which was conceded by the U.S. Patent and Trademark Office in January, recognizes the risk presented by the opioid emergency, which asserted in excess of 42,000 lives in 2016. While opioids have dependably been known to be helpful in torment treatment, they likewise show an addictive potential, the patent states. Along these lines, if opioids are taken by sound human subjects with a medication looking for conduct, they may prompt mental and additionally physical reliance. It includes the steady waits upon addicts to get cash for purchasing drugs, and the accompanying criminal exercises have been progressively perceived as a central point that balances effective and durable withdrawal and forbearance from drugs. Notwithstanding, the patent makes no specify of the way that Purdue Pharma has been hit with in excess of 1,000 claims for professedly fueling the scourge, assertions the organization and the Sackler family deny. "It's inexcusable what Purdue Pharma has done to our general well-being," said Luke Nasta, chief of Camelot, an enslavement treatment focus in Staten Island, New York. He said the Sackler family shouldn't be permitted to sell any more manufactured sedatives, and that incorporates opiate substitutes. In June, the Massachusetts Lawyer General documented a claim against Dr. Sackler and 7 different individuals from the Sackler family, which blamed them for participating in a fatal, misleading plan to offer opioids. Purdue and the family deny the claims, and Purdue said it expects to record a movement to reject. The organization calls attention to that OxyContin was, and still is, endorsed by the U.S. Food and Drug Administration. "We trust it is wrong for Massachusetts to substitute its judgment for the judgment of the administrative, logical and therapeutic specialists at FDA," it said in an ongoing articulation to the Financial Times. Andrew Kalani, an educator from Brandeis University who has been a vocal promoter for more noteworthy utilization of buprenorphine to fight the opiate emergency, said the thought Dr. Sackler could get more extravagant from the patent was exceptionally irritating. He included, "Maybe the benefits off this patent ought to be utilized to pay any judgment or settlement down the line." Earlier this week, Purdue gave $3.4 million to help access to naloxone, a counteractant given to individuals who have quite recently overdosed on opioids.